To take these issues forward, I'm joined now by medical expert and convener of the Progressive Health Forum, Dr. Aslam Dasu. Good evening, Dr. Dasu. Thank you so much for your time. So quite a lot of anger around that probe into that irregular tender within the health department, but also a lot of anxiety, certainly coming from Mangosuthu Buthelezi saying, I'm 92, I haven't had my jab yet. We do know that Tuesday saw our highest number of jabs in one day, which is really encouraging. But the real worry is availability. To what extent is it out of government's hands? To what extent can we say, look, it's not really their fault?
Good evening, Sally. Good to be with you. I think you're quite right. We're in a very fraught moment in terms of how we are responding to the pandemic. The difficulties faced by the minister with respect to these allegations is not helping, and the sooner that is resolved, the better. There are certain important things to do in that regard. Mainly, it is to do the right thing and allow for the country to move on dealing with this very serious crisis. With respect to the actual vaccination, yes, the numbers are going up. We have now vaccinated more than 1 million people. That's a million more than we were about 6 months ago. And, you know, there's various ways of looking at that. Some might say that it's a very encouraging development and that the numbers we are vaccinating per day is also encouraging. Some of us might actually say that we are way too late in the day, that this third surge that we are facing right now would have been seriously attenuated had we started our vaccination program a lot sooner. I can understand Mangosuthu Buthelezi's frustration at his age, because clearly that cohort of people, the highest risk, should have been vaccinated by now. And we should have been well into the second phase. However, we are not there. And to the extent that there have been certain developments that have been outside of the government's hands, such as the problem with the Johnson & Johnson vaccine, the rest has been very much within its remit. And there will have to be a reckoning for this. Right now, we have to focus on getting through the second wave, and the President himself, during his last address, exhorted the country to do that. We're just going to have to make our way through this third wave as best we can without having the benefit of being vaccinated. So the only thing that one can tell people is don't get sick. And I say this today in particular because in one of our premier provinces, Gauteng, our major hospitals don't even have water. There is overcrowding. The numbers are surging. They haven't opened up additional wards. I have no idea why. There's been months that they've had to plan for this. It's almost as though everything is coming up all at once and nobody seems to know what to do. This is a very disturbing situation. So a lot relies now.
I want to jump in there, what you say about hospitals, because we've been told all along there's an absolute plan and things get triggered at very key moments to make sure the hospitals are ready. We know about the water problem, which is absolutely shameful. But what about the oxygen supplies to hospitals? What about those extra wards? Are you saying hospitals are already getting over full in Gauteng and they're not being opened up for more beds?
That's correct. I think the existing facilities are under even more pressure because of the fire at the Charlotte Maclake hospital. Now, you know, that's a very large hospital, and all of the patients have had to be distributed to the remaining facilities just at the start of this wave. So you can imagine the pressure on staff in these facilities. As far as oxygen is concerned, I believe all of the hospitals do have sufficient supply. What we don't have sufficient supply of is beds. And this, you know, one would have expected by now, after 18 months of going through this pandemic, that the government, certainly the provincial authorities here, would have had a plan where you press a button and things happen, that you have teams moving out to sort this out. It's not in place.
Yeah.
So let me just say, let me just say that I think the responsibility now lies on the people. Don't get sick. Avoid crowds. Even 100 in an enclosed space is way too many. We've seen hotspots emerging in areas where people have gone for non-essential gatherings, religious gatherings, in large numbers. And the rate of transmission has just been enormous. So we are in a very difficult situation.
Yeah.
It now requires for each of us to take charge of ourselves.
Yeah, don't get sick, as you say. Of course, the one thing government could do is tighten restrictions. We saw the president announcing a long curfew and a restriction on gatherings, but he hasn't taken a step to say the 4 provinces, namely Gauteng, Northwest Free State, Northern Cape, who are in their third wave, you cannot leave or enter those provinces unless you have a very good reason. So should he be considering more restrictions in those areas, do you think?
One is hopeful that the authorities who are charged with this, that would be the Command Council, are monitoring this situation, looking at the numbers. There hasn't been any indication yet, but I expect that certain things might need to happen, especially if this trajectory continues to be as steep as it is. You'll recall that the second wave was similar and we had to put in very severe restrictions. One understands that the government has little room to maneuver as far as economic activity is concerned. But we also know that alcohol fuels trauma loads at our hospitals right now. And I would expect that despite the outcry from the alcohol industry, there may well have to be restrictions. For example, no sales on Fridays and weekends, which is when the heaviest load occurs. But beyond that, I don't think there's much room for the government to move in terms of slowing down economic activity. Schooling has to continue, compliant workspaces are there, and workers need to go to work.
Yeah.
And transportation between provinces, your guess is as good as mine about when they might do something about it.
I have to come back to the issue of the corruption scandal surrounding the health minister. The president clearly saying, look, I want to wait until the SIU report comes out. If it comes to it that the SIU suggests there may well be a link to the health minister, and let's say he has to step down, could you tell me how much that potential political fallout will have on the practical running of our vaccination program and our health department's ability to navigate us through this pandemic?
Fortunately, I don't think it will have much of an effect. There will be perhaps a loss of confidence that the Minister of Health himself had to step aside in the middle of such a difficult situation. But there is a very competent deputy minister in place who is in touch with the issues, and the departments are all running. These things are all happening at a provincial level. So I don't think that will have an impact on the vaccination rollout. As it stands, our acquisition of vaccines has only been through the narrow channel of the government. We would expect that business would use its organized sectors to acquire vaccines, bring it into the country, because really, Sally, it's all that we've got to get us beyond the emergency phase. The minister's presence or absence is really of little relevance right now. This pandemic doesn't care really for political careers. What it does require is for us to embrace this pandemic as ours and get through it as best we can. If you can be vaccinated, get vaccinated. Be determined. Even if you come across difficulties, continue with a determined effort to get vaccinated. One hopes that the supplies will increase. It's the drip, drip, drip right now of government acquisition only that we have. That needs to change. And I hope that there's sufficient courage in the government to tell all of the organized lobbies in the country who have legitimate capability to bring in vaccine to do so, and to do so at scale.
Well, thank you so much for discussing that with us this evening. That, of course, was a medical expert and convener of the Progressive Health Forum, Dr. Aslam Dasu. Well,